Good evening, everyone. I'd like to welcome everyone to tonight's MSIG webinar, which is High School Team Position Coverage and Opportunities for Trainees. This webinar will be an amazing opportunity for trainee members to learn from four AMSSM members as they share their experiences and expertise on sideline coverage. My name is Jordan Schuck, and I'll be serving as the moderator for tonight's webinar. I am one of the AMSSM MSIG officers serving currently as one of the two at-large members as MS1s. I grew up in Virginia in the northern DC area, went to UVA for college, and have had my fair share of sports, including soccer, swimming, basketball, and currently more of a runner. But I'm currently an MS2 at Georgetown in DC. So just finishing up my MSK block. Tonight, we're honored to have four AMSSM members on our speaker panel. After their presentations, I will serve as the moderator for the Q&A segment. And so during the webinar, please enter your questions in the chat. And during the Q&A, I'll ask each question and ask the speakers to respond to each question. So now I would like to introduce our first speaker, Dr. Brooke Pfister. Dr. Brooke Pfister is a pediatrician who practices primary care and sees internal consultations for pediatric sports medicine in Westbrook, Maine through Maine Health. She attended medical school at Columbia University and completed both her pediatric residency and sports med fellowship at Anne and Robert Lurie Children's Hospital of Chicago. She is co-chair to the Innovation Subcommittee of the Practice and Policy Committee and was lead author of the recently developed AMSSM High School Team Physician Toolkit. Dr. Pfister, please begin your presentation.
Fantastic. Well, first off, thank you all for having me. I'm excited to be here. And a disclaimer on this, I'm actually not currently doing high school team physician coverage, but had great opportunities during my fellowship, and I'm excited to hopefully get involved. We recently moved to Maine, so get involved in the community here and maybe use this toolkit. But one of the reasons that I was brought on to discuss today was I had the pleasure of working with a great group of both attending level physicians as well as fellows, residents, and medical students on the development of this high school team physician toolkit, which I'm going to share with you and is also available on the AMSSM website. So if you guys can see this here, again, the idea behind this toolkit was really to answer a lot of frequently asked questions that were coming up, especially from our younger career physicians, regarding kind of how to become involved at the high school level with coverage. I think, as many of us know and will speak to tonight, there is kind of very well established kind of coverage and expectations for physician presence at the college level and then at the professional level. But at the high school level, it can be more challenging. I think one of the biggest things being financial limitations, and often schools at the high school level aren't able to offer compensation, and that can be challenging. And they might not be able to kind of work with the hospital to provide malpractice. So I think there are a lot of kind of ongoing issues that come up when really well-meaning sports medicine physicians are trying to provide a very needed position of physician coverage on the high school sidelines. And so we kind of, within the Practice and Policy Committee, collected a lot of the frequently asked questions that people were bringing up. I think a lot of it was coming up at the AMSSM meeting when they have kind of the breakout sessions for different level physicians in terms of sideline coverage. And the high school team physician breakout session was often kind of, there were many questions that were coming up time and time again. So we wanted to kind of pull resources and have a document that both, I mean, trainees, then also early career physicians or people who are just interested in becoming more involved at the high school level have kind of a single place that they can look for information and resources. And the nice part about it is that it is a living document. And so the idea is that we kind of, as we get more feedback, as we learn more about resources, that we're hearing that from the other members and that we're updating the document accordingly. To that end, we actually are currently working on an update. So as I go through some of this, I'll be able to mention a couple of the areas where we plan to update in the near future. But if you look here, so the place that you can find this on the AMSSM website is if you go to the main page and then go under the advocacy tab. And then within the advocacy resources, there's a link, like a member only link, where you can click and it'll access this PDF. You can see here, if you ever were kind of reading it, had suggestions for edits or additions to the toolkit, like you found a great resource that you think would be helpful for people, you can always email us at practiceandpolicy@amsssm.org, and we can kind of incorporate that in the next round of updates. So feedback is always appreciated. Just to give kind of a brief overview of what the toolkit is and how you can use it, you can see the table of contents here. We've tried to divide it up again based on frequently asked questions. And I'll just briefly kind of go through some of these to give you a little bit of an overview of what we might be reviewing. So the first section is just the questions that came up about how do I best approach the school to offer services. So you're a sports medicine physician, you're really interested in getting involved in the community. You know that there are some high schools in the area that could benefit from team physician coverage. How do you kind of approach them and what do you say? I think it has some great tips here. Again, really emphasizes, and I think this was from discussion with many members about how kind of they became involved, but grassroots efforts can be really meaningful. So number one, kind of communicating with local school districts, talking to local PT clinics, who might have athletic trainers that work at different schools in the area and figuring out where there's a need. I think that's a really important thing. I think another great opportunity is to volunteer. So I know during fellowship, I had the opportunity to provide some like lectures for athletes and parents at some of the local schools. And I think that's a really great opportunity to, again, then not only the
You.
athletes or the coaches, um, but the families might get to know you. And um, I think building those connections and again, offering your time can be a great place to start and kind of build rapport and hopefully establish an ongoing relationship with that school and that community. And then I think also utilizing resources like your local high school association. Again, that could be an opportunity. Also, each of the state high school associations has a sports medicine advisory committee. And so the SMAC is like a multidisciplinary team that's made up of all sorts of stakeholders in this. And that could be a good place again to start if you wanted to learn about kind of where the needs are and what schools maybe have expressed interest in this previously. When they talk about making initial contact, some of the key people to connect with would be the athletic director at the school principal, and then absolutely before you're signing any contracts or really getting involved, I think it's especially important to connect with the athletic trainer if there is one available on the sidelines, as well as the school nurse, just to learn more about like resource accessibility and what sort of infrastructure they already have in place in terms of AEDs. Do they have emergency action plans? Do they have a spine board? Is EMS at their games? That sort of information can be especially important before kind of to know going into it, because I think it can help you figure out how you might be most helpful, number one, but then to kind of make sure that you're comfortable operating in maybe a resource limited environment. And then talking about marketing your services, these are just some kind of general suggestions. I like this part. I think this can be a helpful area where we highlight some of the data. Um, but I mean, things here that are important, like team physician coverage at the college level, again, very well established. I think it's been a priority at the college level, yet catastrophic injuries occur actually more frequently at the high school level. So there really is a need. And having someone on the sidelines who has this specialized training can not only support evidence-based practices, so things like emergency action plans, things like emergency preparedness, um, emergency response, and then also like addressing or recognizing early and then also addressing more catastrophic injuries is incredibly important. So the next section within the toolkit is how should I define the scope of services that I provide and what limitations should I consider? Again, there are a ton of resources that you can see kind of here at the bottom. Resources and references that kind of provide an overview of scope of practice. The big things that are also emphasized here that I think are important, especially for early career physicians, are just recognizing that your the scope of services that you might provide could be different from another primary care sports medicine physician based on your training. So just making sure that you're making an agreement with the school and the community, and that's one that you feel very like comfortable and confident carrying out appropriately. So these are kind of a list of some of the things that you might be doing. But again, based on resources available, based on your training, based on your comfort level, you might not be able to provide all of these resources, but that doesn't mean that it's not still an incredibly beneficial service you're providing. The next two are focused on kind of contracts. So this is kind of whether you should insist on a contract or written agreement, who initiates it, and what should the terms be. The long and short is yes, you should have a contract because it can be really beneficial in protecting you from a liability standpoint, really clearly defining your role and your limitations. And one of the things that we're going to be adding kind of in the next update is actually going to be a sample contract and what that might look like, because I think that that can be really beneficial. The next section here focuses on how you might consider liability insurance or maybe convince your employer to cover liability insurance. And again, I think it provides some nice suggestions, and this is an area that we're also going to be revamping a little bit with the updated section. So keep your eyes peeled for a new version. But I think it really emphasizes the importance of working with your existing hospital or medical group. So even if they're not the ones providing malpractice insurance for your team physician coverage, even if it's something that you're getting kind of on your own as a supplemental insurance, making sure that your hospital or medical group are still on board and kind of aware that you're doing this, and that there aren't any restrictions in your contract that limit sideline coverage and other things like that. So going through here, this I think is a really high yield section. So just talking about what supplies you should have in your sideline bag. Again, this kind of took resources from a variety of different places and kind of compiled them. So a good place to start. Also recognizing that, again, you might not be the only person on the sidelines. There might be an athletic trainer. It might be different in terms of home versus away games, where there might be another physician when you're traveling with a team who's representing the home team and might have kind of more things within their sideline bag. But I think this is a great place to start and a good place to kind of go through maybe with your athletic trainer, with the school nurse to determine what makes the most sense in the setting that you're going to be practicing in. And then I really like this section as well, just giving you some suggestions for how to prepare. And the way that this section is divided up is thinking about kind of preparation preseason or before the game, thinking about game day sideline preparation, thinking about emergency preparedness, and then also non-game day preparation. So it kind of goes into all of these things in a little bit more detail, but gives you some ideas of what you can be doing to be best prepared and what resources might be most helpful for that. And then, and again, this has a nice section with specific resources. So thinking about mental health and safe sport, I think that's a really important thing to acknowledge at the high school level too, is that as the kind of trained physician on the sidelines, you're not just dealing with sports injuries, but other kind of mental health things can come up. And so it's really important to feel comfortable in that aspect of it. There are a lot of references to some of the AMSSM statements, such as the like return to play, concussion, cardiovascular screening, and abuse in sports statements. And then the last section really just kind of rounds out some kind of additional topics that you should be thinking about as a high school team physician. So certainly liability, thinking about the logistics of travel, both with regards to kind of what you're going to bring, a difference in resources in different places, but then also thinking about the medical legal implications of traveling across state lines. And then some of the challenges that come up with it. And I think, again, a little different than the college and professional level, where most of the patients are 18 and up. You really have to think about like patient confidentiality, informed consent, and again, knowing that there is always going to be kind of an influence of third parties. So people like parents, teammates, coaches, administrators. And then again, compensation. So rapid fire overview, but hopefully you can see that it can be a great place to start. It's a great compilation of resources. And again, always welcoming feedback so that we can make it even better going forward.
Thanks, Dr. Pfister, for your informative presentation on the AMSSM High School Team Physician Toolkit. It's my pleasure to introduce our next speaker, Dr. Natalie Ronshaugen. She is a sports medicine physician at Children's Nebraska and an associate professor of pediatrics and orthopedics at the University of Nebraska Medical Center. She is trained in internal medicine and pediatrics at Bay State Medical Center, part of the University of Massachusetts, where she discovered the field of sports medicine and completed her fellowship in sports medicine at the University of Colorado. She is head team physician for the College of St. Mary and a team physician for Bennington High School, as well as a member of the Nebraska Schools Activities Association Sports Medicine Advisory Committee. She is the Director of Sports Medicine Education at Children's Nebraska and core faculty for the University of Nebraska Sports Medicine Fellowship. Dr. Ronshaugen, you can now proceed with your presentation.
Thank you. And I just want to give you major props for pronouncing my name so perfectly because nobody can do that, and you rocked it. So thank you so much for having me. I have been tasked with talking about the role of the high school team physician and how that works alongside the athletic trainer. So like she said, I am a team physician for Bennington High School, and that's mostly what I'm going to talk about today. I'm also the head team physician for the College of St. Mary. So in terms of my role, I am one of the team docs at this high school. In that role, I cover home games for the football team. So my actual in-person role is just a few games during the fall, and they're home games. But there are lots of other sports at this high school. And while I do have some more administrative roles as the team physician, the in-person stuff, I can't make it to everything. And so that's really where the athletic trainers come in. This is a great picture of our athletic trainers at state football a few years ago. So I don't know how comfortable you guys are with the role of the athletic trainer. Full disclosure, I am from a small town, and I did play college sports, but I was on the women's tennis team, and our coach was a physician, so they did not assign us an athletic trainer. So I did not know what an athletic trainer was or what they did until I got much further along into even residency. So let's talk about that for a minute. Athletic trainer is a hard title. It seems to insinuate that they are one of the personal trainers or somebody who can get somebody just to work out, and that's really not what they do. So they have a bachelor's degree. Now they are required to get a master's degree. You will still be working with many athletic trainers who have only a bachelor's degree and lots of years of experience, but moving forward, people coming out of athletic training school are required to have a master's degree to practice. There is a PhD available. Most of the athletic trainers who have PhDs focus on research or administrative roles, but you can get a PhD. The role of the athletic trainer is very multifaceted. So these are the medical professionals on the field who are taping ankles. They are rehabbing more of the minor injuries. So they'll rehab your ankle sprains, your things that don't need quite so much one-on-one attention. They understand the rehab process for the more complex rehab needs of the athlete. And at the collegiate level, they do a lot more complex physical therapy type rehab. Though at the high school level, they tend to have so many athletes per athletic trainer that they do the more basic straightforward rehab and then send to athletic trainers. But because they've got that rehab knowledge, there's a lot of communication going back and forth between the athletic trainer, the physician, and the physical therapist to get athletes back on the field as soon as possible. They are our eyes and ears as a physician on the sidelines, in the locker room or the athletic training room, on the court. And so they know these athletes super well, and they can give us a lot of information about, like, that kid's limping and he's not a faker. That kid's limping and he's been milking that injury for a long time. But like, this is one I need you to look at. This is one that I need you to watch while they're on the field if I'm at a game. And that insight is so hugely important. And then last and certainly not least is their role in emergency care. So they are generally the first people on the field. They are definitely the first people on the field if I'm not present. So our wrestling matches, our cross country meets, they are the ones that are getting there first and administering first aid, triaging a situation, deciding if somebody needs to go in an ambulance. Emergency action planning is a huge part of the athletic trainer role. And for this, I think they are so incredibly important. This is a picture of this year's emergency action meeting that we hold every year. So there is a fire department that covers our school and brings an ambulance to our school. Not every school is lucky enough to have an ambulance on the sidelines for home games, but our school is. They cover a couple of other schools, and so we were lucky enough to gather all three schools together, and everybody got on the same page. How are we spine boarding? How are we removing equipment? If somebody goes down with heat stroke, how do we get them back down to a normal core body temperature as soon as possible? What are we doing with splinting? What do we have on the sidelines? What's available in the emergency kit in the ambulance? What does the EMS feel comfortable doing? What do our athletic trainers feel comfortable doing? And is that different school to school? So this was a super cool thing. That's Liz, our head athletic trainer for Bennington in the blue. And she organized this entire project, and it has been really awesome. Emergency action planning is also done just at a very grassroots in that high school level. We need to know if something seriously emergent were to happen, how do we get an ambulance in the door? Which roads do they take? Where are we going to meet that ambulance? Who's meeting the EMS to direct them into the gym? So our athletic trainers know the school better than any physician does. And so they make our emergency action plans. Where are the AEDs? Where are the split kits? Who gets called? What hospital do we go to? And then as the physician, I review all of that and make sure that it makes sense and that we're not missing any components. And again, they just know their athletes so well, not just the school, but their athletes. They know what the expectations of their athletes are. Schools are at lots of different sizes, lots of different competition levels, and they can help you very much navigate goals of athletes, goals of coaches, and how we get people better, faster, and in the safest way. In terms of emergency medical care, I want to spend just a little bit longer talking about this. So emergency medical care, again, that athletic trainer ideally is on the sideline with you if you are a school that is lucky enough to have one. And if you are in medical school or residency and have the opportunity to shadow on the sidelines at a high school event, it is really important that you touch base about the emergency action plan. Like, what is the plan if something goes south? And B, basics of how they want you to function on the sidelines. There are athletic trainers that, if it's your first day, they may just want you to shadow. They may want you to stand behind. They may want you to stay on the sideline and have them bring athletes to you. As a physician, I have a very good relationship with my athletic trainers on the high school staff. And I know if they go out there and that athlete is conscious, they'll go out by themselves. And I don't need to get in the way of that. If they can get them off the field so I can evaluate them on the sidelines, that is ideal. Um, and then we have some hand signals if they need me on the sidelines ASAP. So I just watch for those. And if they give me those hand signals, then I run out. It gives them a little bit more space. It doesn't um, cause as much anxiety for the athlete because they know their athletic trainer much better than they know me. Um, and sometimes it helps speed the game along. If it's just a simple ankle sprain, they need help off the field. They don't need the physician out there clogging the works. And so if you're thinking about shadowing, talk to the athletic trainer. What are the expectations? How can you help? And that's going to get you a long way in their eyes and also in the eyes of the physician that you're working with. In terms of getting involved, if you are at a medical school that has an orthopedics department, that might be a good option to start with. Try to find a physician who's already covering a high school that you can shadow. And if you love a specific sport, consider about starting in that sport. Maybe that's not the one where the physician is on board. Maybe that's one where you can go work with an athletic trainer one-on-one and see how they work on their own. Tennis, for example, there are tennis teams that have athletic trainers on the sidelines, or cross country, something where maybe the physician's not there, but you can really see the bandwidth that the athletic trainers have. And this is just talking again about if you are shadowing, talk to your physician, talk to the athletic trainer first about where you can be best utilized. And maybe there's a job for you to do. Maybe they need extra hands to get water bottles out to athletes. Maybe they need extra hands for blood, like they need somebody to go grab the blood kit. There may be things like that where you can be highly utilized and helpful on the sidelines. And then if you get involved in shadowing, just be careful what you wish for. Bennington Badgers is now, they hold the record for the most consecutive wins in Nebraska Class B state history. So I've been on the sidelines a lot now because they just won't lose. We won 3 state championships in a row, and then last year we lost at the state championship. So you may be hanging out for a long time. This is me and my partner, Dr. Moffitt. Dr. Moffitt was an athletic trainer before at the professional hockey level, before he became a physician. And now we get to not only cover our own state high school or our own high school events, but we also cover a lot of the state tournament events, which is super fun. The gal right behind me, the blonde gal right behind me, is an athletic trainer who is staffing that event with me. So it's fun. The athletic trainers are huge resources for you. They're great with physical exam. They're great with understanding ins and outs of logistics of sports medicine. So utilize them, and that's that.
Great. Thank you, Dr. Ronshaugen, for your presentation. It is my pleasure to introduce our next speaker, Dr. Brandon Bockewitz. He is a board-certified family medicine physician with a certificate of added qualifications in sports medicine earned through fellowship training at Wake Forest University. Since 2006, Dr. Bockewitz has been actively involved in high school athletics coverage, combining clinical expertise with a passion for keeping young athletes healthy and performing at their best. He is currently based in Peoria, Illinois. He practices with Carla Health, focusing primarily on non-surgical orthopedics and sports medicine, while also maintaining a small family medicine practice. He is head primary care physician for the local professional hockey team, the Peoria Rivermen, in addition to his high school sports coverage. He is an associate professor at the University of Illinois College of Medicine and is responsible for the orthopedic, sports medicine, and musculoskeletal education of medical students and residents. With nearly 2 decades of expertise in sports medicine-related injury management and prevention, he provides a comprehensive and practical perspective to the care of athletes at all levels. You can now proceed with your presentation.
Oh, that makes me sound so smart. All right, so Peoria. Try it again, Jordan.
Peoria.
There we go. Nailed it. Thank you. Yeah, Chat GPT does wonders for your bio there, so I appreciate that. All right, so yeah, I got the privilege tonight to go over the how do you kind of get involved, and lucky for me, everybody else who's spoken before me has also covered a little bit of how to get involved for me. So just a little bit of background here real quick. Let me move through my slides. No, there we go. Have the stupid no disclosure page that everybody has to have. There you go. So I've been working at the high school level basically since my residency. I started my first year. I'm a family med resident by primary training, with again my sports medicine fellowship training on top of that. I was very lucky to do my residency here in Peoria, where we had a very well established sports medicine physician working on staff with the residency program, and a lot of great orthopedic providers in town. Here in Peoria, Ortho kind of owns all the high schools, but as a resident doing the different rotations, I was able to kind of get in and build what I wanted to build there to get me some exposure. I kind of came into med school residency interested in sports med, knowing that that's kind of the route I wanted to go. So it was easy for me to kind of jump on that early. I've done high school level, I've done college level, I've done professional level. So again, I'm kind of in a very unique area where I have access to a lot of that stuff to be able to do it. So I kind of broke this down by level. We're going to go through kind of medical student, resident, fellow, and then even attending opportunities. And really for me as a medical student, it really came down to finding that resident or fellow that you knew was involved in sports medicine, in musculoskeletal medicine, and whatever you were interested in doing. Residents and fellows are very interested in finding anybody who wants to come work with them and either do their work for them or just stand on the sideline with them so that they actually have somebody to talk to. So it just, as you go through your rotations in med school, getting to know the residents, getting to know the fellows, getting to know the attendings is a very, very easy in. A simple little email. Hey, I'm MS whatever. I'm interested in this. I'd really like to know more. I know you do this. Would you be interested in helping me out? I think it's going to be very hard to find somebody that's going to turn you down and say, nah, I'm just not interested in doing that. So as a med student, that's who I would encourage you to reach out to, would be the residents that you've worked with. If you do, go or at school at a fellowship program, then great. You're going to have fellows that you can work on too. I had a unique opportunity as a medical student. Our medical school allowed us to kind of create as a fourth year some of our own unique rotations. So I was able to create a month-long sports medicine rotation for myself. September, October, somewhere in there during football season. I knew our program director at one of our sister schools down the road, and I just reached out and said, "Hey, I did this rotation with you. I'm super interested in sports med. I'm kind of putting this rotation together for myself. Would I be able to come out and work with you and the fellows and blah blah blah?" And great, the program director helped me set it up. The faculty at my school helped me set it up, and it was just a great opportunity for me to just get out, see what was out there, to be exposed as a medical student, to see if that's really what I wanted to do. So as a medical student, I'd put it out there, just make the contacts when you're going through your rotations. If you really latch on during your orthopedic rotation, your sports med, your whatever, those are going to be the people that as a medical student are really going to be able to help get you involved into that next level, be it sports coverage, be it research, be it whatever. So that's my advice for the medical students out there, is kind of one of the ways that I would get you involved. As a resident, it's going to be a lot of the same stuff. If you have a fellowship program at your residency or at your school, again, reach out to the fellows. They're gonna want to get people involved. They're gonna want to have help at an event. I've many times been there by myself where I wish that I had somebody else there with me to help me out. And then again, it's kind of similar. You're going to go through your orthopedic rotations, be it the family med, ER, PM&R, whatever your residency is in. You're usually going to go through some type of service or rotation where you're going to meet those contacts where, the fellowship director, hey, I'm interested in this, can you get me involved? The community faculty. So I'm kind of an associate professor with our med school here, but I'm really more of a community faculty member where med students, residents will come out and rotate with me. And again, it's just that, oh wow, I didn't know you did that. Would we be able to come watch you or help you or shadow you? And as it's previously mentioned, if you have the opportunity to get connected with an athletic trainer, huge, huge, huge resource. I just cannot emphasize enough the value that those people bring to what we're doing. Um, and then, if you have to, it's one of those, if you get the blessing, from your faculty or from your program director, hey, nobody does this, can I reach out? So that was me as a second and third year resident. We didn't have a fellowship program. We had the opportunity to go out with our faculty member, but there were also other opportunities. So as a second and third year resident, I was doing solo coverage, 1 year with an athletic trainer, 1 year without an athletic trainer at a local school by myself, but it was through my program, knowing that they had signed off on it, that it was a volunteer opportunity, but I was going to be covered under my residency malpractice because it was basically considered a longitudinal part of my sports med rotation. So there's lots of different ways that you can build it out there. It's literally just reaching out to whoever's willing to listen, get you hooked into the system. I went through athletic trainers, I went through athletic directors, I went through principals. It just kind of depends on where it is. At the fellow level, I shouldn't have to say anything. If you're in fellowship and you are not working at a high school, I'm not sure you're really in a fellowship. Now, granted, you guys might be working at the college level and the professional and the university level and different stuff like that. But high school for me and in fellowship was one of those. Look, you're in charge. You do what you want. There's an MD behind your name. You've been through residency, you passed your boards, you are just as qualified to be out there as anybody else. And then again, it's kind of the opposite for the fellows. Find an interested medical student or resident who wants to do your work for you so that you can sit there on the sidelines and hopefully enjoy some time to just watch the game that's going on. And then I did want to throw in kind of the attending level because this also applied to me when I graduated fellowship and came back to Peoria. Um, there, the hospital system that I joined, they had no connections with anything. They kind of gave me their blessing and said, hey, yeah, if you want to go do that, you can find it. And we're willing to cover your liability, but we're not really going to help or push it. So that's where, again, I was kind of starting all over. So reaching back out to the ortho connections, reaching out to the schools, reaching out to the athletic trainers, basically just looking for any possible opportunity. I mean, if you just go, plug into Google your local orthopedic group, they're gonna have a list of schools they cover on their website. They consider it advertising and hey, look at us, here's who we cover, you should come see us. So it's really easy to get a list of who covers what. What's not as easy is knowing what kind of coverage they have. I'm the only one in my group here in Peoria that is sports med trained. I'm the only one that covers a school. I'm the only one that does that type of community outreach. So, there's no way I could cover 3, 4, 5 schools by myself. That's where I would have to get an athletic trainer, and then that's where opportunities would open. Where if there is, I don't want to say just an athletic trainer because they do way more there than I do. But if there's not a physician presence, usually that school, that athletic trainer is going to be very open to help getting that extra help there, having a physician on the sideline to help them out. The more hands that can be there to help in an emergency is always a great thing. So that's kind of my advice for the attendings. Just reach out, hit your contacts and kind of see what's out there. Somewhat not to do maybe things. is, brag about how great you were at high school football, and that's why they should let you come on and play, or just go out there. But really, what not to do is just don't assume it's going to happen just because you want it to. Get out there, make it happen, reach out to your contacts, just dig, push. You're gonna be able to find something. And for me, it's kind of one of those. I do it more as kind of my payback for community service here. Ooh, that came out really wrong. Um, my option to do community service, to help out the community that I work in, to make sure that the kids out playing sports have somebody to help them out, because where I cover, they don't have an athletic trainer at school. They can't afford it. It's a small county high school. So those of you that live in cities and go, what do you mean a county high school? I mean the whole county goes to one high school, and there's probably not even 100 kids there. So very, very small school. But again, the coaches, the family, the teachers, the administration are all greatly appreciative of what we do for them. So that is all I got.
Thank you, Dr. Bockewitz. So we have our last speaker, Dr. Michael Baham. He is a first-year resident in the UCLA Family Medicine Residency Program. He earned his medical degree from the University of California, Irvine School of Medicine, where he was a scholar in the Prime Leadership Education to Advanced Doctoring African, Black, and Caribbean program. Before medical school, he served as a K through 8 before and after school teacher in Orange County. He later joined the UCLA Steve Tisch Brain Sport Program, where he was involved in traumatic brain injury research, clinical care, and community outreach. Following residency, Michael intends to pursue a fellowship in sports medicine and continue his career in academic medicine and research. You may begin your presentation.
Cool. Thank you, Jordan. Let me see. Let me do this correctly. That's just a screen. Okay. Can you see my presentation? Cool. Awesome. Yeah. So hi, everyone. I'm Michael. Thank you to the AMSSM and for Joan for inviting me to speak about my experience in the NFL Sports Medicine Pipeline program that I did in my 4th year of medical school. So a brief intro about myself. If I can advance my slides. Cool. Yeah, so I'm Michael Baham. I am originally from like a Southern California area, and then went to school at UC Irvine, and just recently graduated from there. My path into what was formerly called the NFL Diversity and Sports Medicine Pipeline Initiative, now just the Sports Medicine Pipeline Program, is pretty unique. Just so some background for it. My dad has always worked for the Chargers ever since he was like 18, when they were down in San Diego. He worked his way up from like a ball boy, and then became like the referees, officials, like locker room attendant. And so when the team moved to Los Angeles, and I was in med school in Irvine, I basically took over that job. And so for the past few years, I've been in the locker room working as the referees, like locker room attendant. And I knew this program was available. I kind of just found it via Google. I was looking to get involved. And then I just went up and introduced myself to the team physicians. And they were gracious enough to have me on for this program. And the rest is history. And so, yeah, a pretty unique and kind of, not formal way to get involved in this program. But there was no application process for it, but I think that's beginning to change. And so, yeah, pretty unique way into this program. And I'll briefly like share what it's about, some key takeaways, and then its impact so far on my residency. So what is the NFL Sports Medicine Pipeline Program? So this was a collaboration, and is a collaboration between the NFL Physician Society, and the Professional Football Athletic Trainer Society. And it was developed, I think that should say 2022, with the goal of encouraging 3rd and 4th year medical students from a variety of backgrounds to consider sports medicine as a career. And when it was initially sort of launched, it was specifically partnered with HBCUs, but they're now expanding their reach to a number of different universities throughout the U.S. I think more than anything for medical students, it provides the opportunity to work directly, with a multidisciplinary medical team to provide innovative care for NFL athletes, the highest level of athletes in the U.S., and then fosters mentorship and professional networking, which I'll get to. But overall goals and objectives for the program, mostly to gain exposure to patient care and sports medicine, whether that be within the NFL, and whether that be diagnosis and acute management of injuries, learning about the rehabilitation process, working with athletic trainers, injury screening, injury prevention, all these sorts of things we kind of learned, or I kind of learned throughout my time in the program. And then also, observe and just be present, and shadow and participate in day-to-day interactions and care of the players, coaches, even sometimes. And that could look like any sort of like daily treatment, like prehab, rehab sort of sessions with players, or practice coverage and management, which as a part of this program, you get to be involved in. And so looking a little bit into and I should briefly say it, the picture to the right is obviously a mix of both athletic trainers, team physicians who are all UCLA physicians, and then here in the middle right here is Illich. He just completed this. He was last year's student intern for the program. And so the day-to-day experience, it's pretty loose and sort of up to you and the program or the NFL club, about what you want to do. Just given I was interested in primary care, family medicine, sports medicine, I kind of just wanted the sideline coverage experience. I know others that are interested in orthopedic medicine, orthopedic surgery have gone into ORs with different providers as well. So for me, what it really looked like was observing preseason practices and scrimmages. I was with the team down in LA. This was July 2024, so it was still preseason. So I was able to go to preseason practices and scrimmages. I was able to talk to players, get to know them a little bit during clinic visits when they came in with specific injuries or they were just there for rehabilitation with the athletic trainers. I was able to work on, I feel like a pretty unique part of this program is working alongside the athletic training staff. They really, within the NFL, serve as the primary points of contact for a lot of players. And alongside that, I was able to work with nutrition staff as well to kind of get a better understanding of what they do day to day for the NFL teams. Something unique that I kind of remembered from my experience was, usually after every practice, the nutrition team does some sort of like sweat testing to sort of analyze how much weight, the different electrolyte abnormalities a player may have lost during practice. And then they then supplement that with like a nutrition sort of protocol for them after practice. And so you really get a good understanding of the multidisciplinary approach to care for NFL athletes. I briefly learned about return to play guidelines, on and off the field considerations for players. And then I wasn't able to because it was preseason, but attend some home games and be present on the sideline for medical observation. I know Illich was able to do that this past year. And I think some students in the program from previous years and this year have also been able to do that. So it's really just a cool hands-on clinical experience where it's really shadowing, it's really observational, but you really get a peek behind the curtain of what it's like to care for NFL athletes, the highest level of athletes so far. And so I'll give you, I think the next slide is like a sample schedule. Basically, again, it's really up to you. When I was in the program, it was pretty loose, and I was able to kind of sort of create my own schedule as it fit my fourth year schedule. But it looks like anything from going to the NFL club training facility, working with athletic trainers in like a prehab, rehab practice sort of situation. You can go to clinic with your providers. You can go to the OR if you're interested. And then there's also, opportunities for game days on Saturdays and Sundays as well, where you can go and kind of just shadow and be a part of the medical staff and team. And so some key learning moments and takeaways from this program. Obviously, it's pretty unique for medical students to work within an NFL team. But I think major clinical takeaways for me was just the overall injury assessment and management of NFL athletes. And it's pretty much the same as if any other patient-centered scenario, right? They kept the main thing, which is the player's health and safety. And so seeing how they did that in the training room, seeing how they did that and communicating with different stakeholders, whether that's coaches, whether that's managers, whether
Oh, I
that's
used the last bag, didn't I? I'm sorry.
I think um, whatever that looked like, it was pretty, sort of inspiring to see how they sort of handle the different sort of stakeholders and the different pressures that may be within the NFL, but then assess the players as a patient and kept it pretty patient-centered. And I think all within that is a major takeaway for me was the communication that was involved. Whether it was like the athletic training staff letting the orthopedic or primary care docs know about the injury they saw, then working them up from there, talking to nutrition or the mental health providers of the team. It was all pretty seamless, and it was all central to the care for the NFL athletes and the Chargers athletes, which translates to everyday clinic flow, hospital flow for patients, right? And some professional takeaways was just how they worked under pressure, observing leadership, team dynamics, and also just the cultural competency piece. Also understanding that these are, you know, like I mentioned before, like NFL athletes who have a lot on the line. These are high paying jobs, but also kind of like remaining a calm composure and kind of just talking to them as if they're normal patients. And so it was really interesting to see kind of all these inner workings and dynamics at play. And so how this has kind of transitioned or translated to my experience in residency, and to kind of touch on what this program can do for medical students that are interested, I think more than anything, right, it just provided that real world sports medicine experience at the highest level. I saw how physicians were able to sort of balance protocols, whether they were established by the NFL or the NFL clubs themselves, with their own clinical judgment, right? Despite potential time constraints. That within like a high level football team and game, it can sometimes be chaotic, but it was always sort of inspiring to see how the athletic trainers and the physicians and the medical staff sort of calmed everything down for the players. And like I mentioned, kept the main thing, and prioritized the health and safety of the players. I think more than anything for me, this opportunity provided and fostered sort of meaningful and longitudinal mentorship and networking opportunities. I'm very fortunate to still be, or to be now at the UCLA Family Medicine residency program, and sort of UCLA Health leads and kind of covers the Chargers athletes. And so I'm still able to work alongside the same attendings that I worked with during med school during this opportunity. And so that's been pretty unique as well. And then for myself, when I'm not busy in residency, I still get to work the Chargers games as that referee's locker room sort of attendant. And whenever there's games, I get to stand on the field and sort of talk shop with the different primary care providers and orthopedic doctors that I met again during this experience. And so all that to say, kind of like what Dr. Bockewitz was saying in his presentation, was you never know what sort of connections can sort of what they can lead to. So always just ask, and always try to find those opportunities and be a go-getter in that sense. And for me, I think, and for others as well that may participate in this program, it helps solidify my future career goals and aspirations. I'm still really early on as an intern in family medicine residency, but I think it's kind of provided that solidification of what I want to do in my future career, which is pursue a fellowship in sports medicine. And I know it's been the same for other individuals who participated in this program as well. And then I know there was like a name change from the Diversity in Sports Medicine Pipeline Initiative to the Sports Medicine Program or Pipeline. But I think it still, for me, in my own experience and my personal experience, emphasized the importance of diversity and multicultural representation in medicine. I come from a mixed race background, being Black and Filipino. And so it was an empowering sort of experience for me to get, again, a peek behind the curtain. And so I think it will do the same for others that are interested. Help me feel like seen and supported early on in my career. And that's something I'll never take for granted. I'm very fortunate about. And so I think the most important question is, how do I get involved with all of this, right? So I think I kind of mentioned early on in my presentation was there was no formal application process when I went through it, but I think now that it's like sort of getting more popular, there's more formal application and evaluation criteria that students do have to meet for each institution and NFL club that they work with. So I know for the LA Chargers this past year, that looked like submitting a CV, an essay, a letter of recommendation. And then there was interviews with both sports medicine faculty at UCLA, and then interviews also with the NFL club medical staff. And I think this is pretty, from what I've understanding and what I read online, it's pretty standard across the different institutions and NFL clubs that are participating in this program. So for students that are interested, I would just reach out to either the student that already participated in it, or someone in your administration, or one of those doctors that are covering that NFL team. Again, a cold email goes a long way. A simple handshake goes a long way. So just reaching out. And I think like an important part of this, it's economically viable. It's most expenses are paid by the NFL clubs, which is great for medical students living off loans. And yeah, that's basically it. thank you again, to the AMSSM for having me. That's my email for any medical students that are interested in the program. I'll do my best to sort of connect you with individuals and to get you more looped in to the program, or just any thoughts or questions at all. Yeah, thank you.
Thank you, Dr. Baham. So now we're gonna turn over to our Q&A portion. I think most of the questions were pretty generalized, but there was one question for Dr. Pfister. You mentioned lectures to parents, and athletes while volunteering during fellowship, and they wanted to know what kind of topics did you typically cover, as well as residents, are we allowed to do something similar? And they were wondering about the liability standpoint of what terms they could discuss.
That's a great question. I would say during my fellowship, we had a couple of just existing partnerships with, and again, some of them were a little bit more formalized. So, for example, I spoke to the parents and athletes at the high school that we covered during our fellowship. And because I had gone to residency there, I had also gotten to know the coach and some of the players a little bit because I had done sideline coverage when I was still a resident. But for that topic, the athletic trainer and the school nurse had asked me to talk about concussions generally. And it was nice because it was kind of a build up to it was right before the season. So they were having like an information session just in general for the parents about sports. So the athletic trainer spoke, the school nurse spoke, and then they had me just give kind of a 10-minute overview of kind of what is a concussion, and how, as a team at the school, would we be approaching concussions on the sideline, and kind of the importance of having those conversations with your kids about being honest about symptoms and coming forward if they are having an injury. I think, but then there were a variety of other topics. As a resident, I actually gave a talk, and this was more through kind of a personal connection. One of the attendings I worked with, her wife was an athletic trainer at one of the local colleges, and so they had requested specifically a session on kind of COVID in sports while I was still a resident. And I, again, did a lot of research on it, and I ended up presenting to, again, this group of athletic trainers that were working at the college level on kind of the latest data around COVID and sports participation at that time. And then in fellowship, I also gave a talk to a local, it was just a day camp, but again, it was through a community center. One of the faculty that I was working with happened to, again, have a connection with this community center, and they'd requested that someone come talk about bullying. So I was pediatric trained, and so I went and gave a talk about bullying, and it was with much younger, it was with like 4 to 8 year olds. But I think just, again, making those connections and really being open when you do have the possibility and the bandwidth to do it. I think saying yes to those opportunities, all of those, I mean, I definitely would say I wasn't an expert on COVID and sport before I went into the conversation and the kind of talk that I gave during my residency, but I took the time to kind of do that research, and felt that I had some clinical experience to draw on, having been a resident. And I think the kind of main part of all of this is really seeing what the community or these groups need. And in that case, it was a talk on bullying, it was a talk on concussions for the high school level, and at the college level, it was a talk about kind of how to navigate sports within the pandemic. So finding a need, and I think doing your due diligence, but ultimately it's up to the people that are asking you. And so I think you can have like a very upfront conversation with them about, hey, this is my level of training. I am like a medical doctor. I have however many years or months of residency under my belt where I'm doing this clinical practice. Are there any topics that you think it might be helpful for me to share some knowledge on? And I think as long as you're upfront about all of that, there shouldn't be issues from a liability standpoint. But others are welcome to also jump in if they have suggestions.
We also had three pretty similar questions about sort of sign line, shadowing, and care, and sort of in the liability range. One I think is possibly as a medical student, if you're shadowing an athletic trainer on the sideline, and there was no physician present, an athlete collapses. If you got involved, could you get involved, and would that create any liability issues since you're technically just observing? And then I think more as the resident side of that is, if you didn't have an athletic trainer and you're covering events solo, should you involve other residents or attendings from other fields such as emergency medicine? And then as a PGY2 and you want to volunteer with sideline coverage, how do you ensure that you are covered for malpractice as a resident? And do you have to go through your residency program? Open to anyone who's able to answer.
I'll start with the shadowing an athletic trainer on the sidelines and no physician present. Athletic trainers generally have a supervising physician. That supervising physician is not necessarily required to be there at every event with them, but they have a supervising physician. I would talk with the athletic trainer, A, about their own comfort level with you being there without a physician, and B, you may want to circle back to the physician as well and make sure that they are comfortable with you being there and have a very open conversation about what your role is. If you are there to shadow, generally the expectation would be that you shadow, but the athletic trainer may have something, like if something terrible happens, they may need an extra set of hands. So I think that the goal really is to not presume that you're the physician as the medical student in that sort of a situation. Talk with the athletic trainer. What do they actually want from you? What do they need from you? They are the medical professional on the sideline. And recognize that they do have a physician that is their supervisor that you can go to with those sorts of, is this an okay thing for this school? I don't know if anybody else has any other thoughts on that, but that's how I would approach it.
Yeah, Natalie, I would agree with you. I think it's just knowing your role when you get out there, not just assuming that, well, nothing's going to happen and I'm just going to watch, but clear communication. To answer the other one about, hey, I'm a PGY2 and I'm looking to get involved. Absolutely, I would take you to your program director as the first line on that. See what opportunities are out there to know what your coverage is. Most programs are going to have some type of a pipeline. We just want to make sure that you're covered and that you're going to be, able to do stuff and not just sit there and go, oh, well, something bad happened. Oh, well, I'm not allowed to get involved. The other opportunity then could also be, if they're going to not count it as part of your training or whatever, you could also look at it as a potential moonlighting opportunity. The problem with that is going to be, where's your liability coverage going to come from? It's out there, you can buy it, but it's going to cost you more than it's going to be worth just to go out. So really just make sure your program's on board, go through them, go through the hospital, go through the university, go through whomever. Usually someone in there is going to say, hey, this is going to be part of your education. So it's a longitudinal type of a rotation, and therefore we're going to cover you from that. The other piece I would throw out for anybody, most states have what we call a Good Samaritan law. Look it up. See what it means in your individual state, because it is a state by state thing. So in the state of Illinois, if I'm driving down the road and there's a wreck and I get out and I try to help and somebody dies, I'm covered under the Good Samaritan Act, that in good faith I was trying to help. However, if I have a contract that says I'm going to show up to a football game and I'm going to provide coverage, in the state of Illinois, I do not fall under the Good Samaritan Act, because I am agreeing to be there to provide medical services, even if I'm not getting paid for it, which I'm not. See the disclosure list. So that's the other thing I would point everybody back to, is just most states have it. Look it up, see what it says, and just know what you're getting yourself into from a liability standpoint.
I'm looking at this other question about covering a mass sporting event solo. I there are a lot of components to that. And I think if you have never done a mass event, someone probably has done this event before. And it's if you are still a resident, that's a very complex, a mass event is a very complex thing. You're going to need more people involved. And I would strongly encourage you to have somebody at the attending level, ideally a sports medicine person who can understand the ins and outs of setting up an emergency action plan, especially if we're talking rodeo, because somebody's going to get hurt. That's just part of that sport. So I that that's what I would recommend. At least having somebody at the attending level, ideally having somebody who can talk you through what this event has looked like in the past. And ideally, somebody who's got some sports medicine background who can walk you through how to actually make sure that this event is safe.
Thank you. One of our next questions was talking about family medicine sports med and how you all navigated family medicine programs. Did you look for programs with their own sports medicine fellowship or sports med track? And were family medicine programs generally wary of sports med heavy CVs as opposed to a balanced family medicine one?
Yeah, I can briefly chime in on that. I just went through it. For me, I didn't really I looked for programs that did have a sports medicine track or at least opportunities for me to get engaged with a fellowship, not necessarily as
Oh.
Can you guys hear me now? Sorry. Okay, sorry. Um, I wasn't really too concerned about if the program had a fellowship engaged with it, but if there were sports medicine opportunities for me or for residents to get involved with, that's something I did look for. But I think first and foremost, going into residency, I wanted to be a good family medicine resident. So I think that took priority above anything else. For me, if I liked the training, like the location, that mattered more to me than like the sports medicine piece. The sports medicine piece was just a plus, if anything. So I sort of prioritized for myself different programs that I aligned with mission-wise or patient population-wise. The second part of that question, like programs being weary of a sports med heavy CV, I don't think necessarily so, but um, you also want to be balanced within family medicine and have a diverse sort of range of opportunities and sort of experiences. So again, I think keeping the heart of the application to family medicine is probably the most important piece when applying to residency. At least that's the advice that I had received.
Do family medicine, I'm med peds, but the primary care part of sports medicine really is an integral part of becoming a sports medicine physician. Because while you are taking care of broken bones and dislocated joints, you're also making sure that their asthma is well controlled and that their diabetes they don't have this crashing low blood sugar on the field. So it is important not to lose sight of the fact that the family medicine training is crucial at the end of the day. So you can have all that stuff on your CV. I don't think that that is necessarily detrimental, but I think it's really important to recognize that at the end of the day, you're there for their family medicine training.
Thank you. And then lastly, we have a question for Dr. Baham. As a current MS3 at UC Davis from Los Angeles, he was wondering how long the internship was and if there was a possibility to be involved from a program that is a non-participating school. And then did you have to take any dedicated time away from fourth year?
Yeah, that's a good question. I think for me, my time in the program was 3 weeks, like 3.5 weeks. I know the one who the medical student who just completed it just did 2 weeks because that's what fit into his 4th-year schedule. So all that to say, I think it's pretty flexible, dependent on the NFL club that you work with and then your 4th-year schedule. And then as far as being like the possibility to be involved in the program, if you're not sort of linked up to an NFL club, I'm not too sure. I was able to do that because it was still early on in this program's sort of its creation. So I'm not too sure right now. I think there's more information to be that's needed there. So if you want to shoot me an email, that'll help, and I can kind of help connect you because I'm not too sure what that looks like now, as far as like the application and evaluation criteria do go. But happy to help in any way. So just shoot me an email if possible.
Okay, thank you all. Before we conclude tonight's webinar, I want to express our gratitude to tonight's speakers. It's been an honor to have Dr. Brooke Pfister, Dr. Natalie Ronshaugen, Dr. Brandon Bockewitz, and Dr. Michael Baham to serve on our speaker panel. Your presentations were excellent and inspiring for medical students, residents, and fellows to become a high school team physician once we have completed our training and begun our clinical practice. I also want to thank everyone for attending tonight's webinar. I want to encourage everyone to join us for our next MSIG webinar, Introduction to Competitive Video Gaming and Approach to the Esports Athlete, on Monday, October 27th at 8:30 p.m. Eastern. I also want to encourage resident and student members attending tonight's webinar to consider nominating themselves as a candidate for the upcoming election of MSRC officers and MSIG officers for the 2026 calendar year. The officer nomination forms are located on the AMSSM website, and the deadline to submit your nomination is November 3rd, and the election of officers will be held over a 2-week period. It's been my pleasure serving as the webinar moderator. This concludes tonight's webinar. Thank you, everyone.